is Shabnam Riaz, and here we are with another episode of Health is Wealth. Well, on today's program, the subject is that everybody wants to look good, don't they? It's your right. With today's sort of advancement in technology and everything, there are so many options available in regard of beauty treatments. Laser, Botox, thread lifts, there's just so much going on. To sort out the confusion and what can suit you, what is best for you, what is cost effective, we are here at HiFi and we're going to talk to Dr. Shahibano, who is one of the leading consultants here, and she is also a master trainer, injector and sculptor. We are going to talk to her today about all the treatments that are available and what can work best for you.
Hey, how are you? So good to see you. Lovely.
Nice to see you.
Pleasure. Welcome to the clinic.
It's lovely being here.
Thank you very much. Thank you, Shabnam. Please join me.
All right, so it's wonderful to be here, Dr. Shahibano, at your clinic, HiFi, and you know, I must say, you have decorated it so well that when you actually walk inside, it looks more like an art gallery or something like that, but then I think that's your aesthetic eye.
Thank you very much, Shabnam, for joining me here. It's honestly an honor for me, because PTV coming out from their studios, that's a big honor. And showing the real aesthetic world that what's happening all around the world, and in Pakistan we should show people that what we are doing, that's an important thing.
It's our pleasure.
Thank
you know, before we go on, I would like Dr. Shahibano to talk about her expertise, because she has a very specific expertise, which is...
Yes. Difficult to pronounce.
I usually get it wrong.
The medical aesthetic practitioner, which means, so it is basically the sub-branch of the dermatology. So after getting the training, that was MCPS and MD training in dermatology, then I started that special field of aesthetics, which is all about the cosmetic procedures and the lasers and so many like injectables. You must have read in my introduction as well that says the master injector.
And sculptor.
The sculptor.
Tell us about that. It sounds really interesting.
It's very interesting. So now the people are knowing more about these things because on the social medias it is providing a lot of information. So Shabnam, sculpting means that whenever the people are coming to us, the young faces, those who are bloggers, those who want to do the beautification, you know, the modeling and everything, they want to pose beautiful. So for them, if for example they are 6 out of 10, we have to show them no, they are 9 out of 10. So how we do that, we sculpt the faces by giving them the proper treatments, that is sculpting with the hyaluronic acid fillers, if you have heard about the name, giving them the angles, the gonial angles. So that's a perfect combination of the shadows and the lights that we see in the beauty world when we see the high-end faces in the models.
Right. So in other words, this is very interesting. People are being sort of like more camera friendly than before.
Yes. It's because thanks to the iPhones,
social
medias, they are giving the beautiful filters to beautify them more. So that's that's exactly what people want when they come to us. Giving them the real faces, exactly what they are seeing themselves in the filters. So here our work starts usually.
So right now we've also, you know, got a lovely cup of coffee to enjoy here as well. So the atmosphere is really great. It doesn't feel like we're recording a program as well. It's a friendly chat, which will also benefit our viewers as well. I wanted to ask you that, you know, when you get a patient that comes in through those doors, of course, you know, they may be a celebrity, they may be a blogger, lots and lots of followers, social media. They have a sort of a standard to maintain. So how do you make sure that you're giving them realistic expectations, and also how much is too much? How do you create the balance?
One thing that I want to mention, that in our field, no person is layman. If I consider any patient who is coming to me, they know exactly what they want because they have been following and doing a lot of researches on the Googles. So they have all the answers for all the questions.
Right.
One thing. Another thing is definitely the social media is playing a huge role. From our actresses to their skin quality, to their hair, the way they look, the standards have been definitely touching the high ends. So the expectations are according to that as well. People follow these bloggers and then, or the actresses or actors, and they keep their expectations according to that. Every face looks similar. You see the cheeks, you see the dagger chin, the big lips, short noses, arched eyebrows. Why? That's exactly the reason when the patient is sitting in front of me for the consultation, and whenever the hyaluronic acid filler is needed, and if I'm mentioning the name of the fillers, they are paranoid, they are panicked. Then no, doctor, no, don't give us fillers. There's a class of the people who want the subtle work, who want the rejuvenation, who want a gentle lifting without letting anybody know that something has been done, and they should look beautiful in their own skin. But there's the other half of the people who have really wrong expectations. This is the duty of a doctor to stop them.
That is very
interesting.
Yeah.
Another point that is quite important, another question that you have asked me, where to stop. Trust me, whenever we give the results to the patient, they are very, very happy. And they are actually afraid to lose the results.
Okay.
Even telling them that this product or this result will going to last for quite a long time, that is 1 year and plus. Again, after every 4th and 5th month, they come back to us. Can you give a little bit of more, little bit of lip, little bit of eyes, little bit of cheeks? So that's the duty of a doctor, to stop them. That's exactly where my role comes in.
Right.
To show my loyalty to the patient,
right.
that no, this is not something I have to add on, I have to stop here. You look best in your own face, just keep your skin beautiful, apply some antioxidants, work on your skin, and that's a full stop for me.
And that is so important, the responsibility of the doctor,
Indeed,
as you said.
That's important.
Now, thinking of the situation that we're in, where people are very, very conscious now about how they are looking. Are we more insecure than before? Have beauty demands increased? What exactly is going on?
Yeah, so I want to tell you a little bit of inner story about different people who come to me for the consultations. The trend of second marriages, the trend of beautification, I don't know how I can explain it to you, but the beautification is the thing that, if I have to talk about the Second World War, one of the product that was the most hot selling product was a red lipstick. Why? So beautification has never been stopped, even at the time of the COVID, when everybody was house-bidden. They were not coming out of the houses. They are segregated. The people who were coming to the static clinic, they have not stopped.
Right.
So beautification, if we talk about the beautification, looking beautiful, you and me, let's give our examples. We are putting a little bit of makeup, we are making up the hair, we are bleaching our hair to look beautiful. This is the definition of aesthetics. And we really feel good and positive when we look good.
Yeah.
If you are in the simple clothes, you're sitting in your lounge, your energy is different. If you're sitting in front of the camera, you're putting a beautiful makeup, highlighting your hair, wearing lovely clothes, your energy is different.
You're absolutely
Definitely
right. In fact, I found that the day that you don't change out of your PJs or you haven't washed your face or something, you will be totally sluggish and a different
that's
energy.
Beautification. That's beautification.
Okay.
That's where the trends have been changing. The social media is giving a lot of impact. The beautiful girls posing on the social media. I want to mention one thing. Be realistic. I never want to say this thing, but do not make ideal those people who are just posing about their looks. They're making you feel crazy. If you have, so there are many people, for example, if I tell you the example of the glutathione, which is a very, very big bluster type of a thing and a hot discussion for so many channels and the medias and so many clinics who are earning a lot of money with this thing. We take glutathione as an antioxidant, but if some girl, the young girl, who has been told in her own family that your complexion is not good enough to marry somebody, I just put a full stop. I just have to counsel that girl, this is your genetics. You can't change your genetics. Just don't listen to anybody.
That is so important.
And trust me, in my 15 minutes of consultation, they listen to me.
That is amazing.
For the last 15 years, if she was insecure about her complexion, the bullying from her own family, she listened to me in 15 minutes.
So the real beauty as well comes from within. It's confidence as well, isn't it? The way you carry yourself. And of course these things help you.
Absolutely.
But inside you have to be a secure person. That is really, really important, what you just mentioned. Another thing, unfortunately not all doctors carry the same ethics. Maybe some are a bit lax in their responsibilities, or they're more geared towards a financial gain. How can a patient safeguard themselves when it comes to different types of treatment? Because, you know, now and again you come across people who have a bad experience and have said, oh, we went for a hydrofacial or laser or something, and something adverse happened.
Yeah.
What should people be looking for? There are different qualities of machines as well.
Yes, absolutely.
That are used.
Absolutely.
Can you tell our viewers about
Absolutely. So that's quite informative. You guys are playing a very huge role. You guys are giving information to the people. And there are so many people, definitely, they're spending the money on their beauty, so they come here with a lot of research. Now people are knowing. Aesthetics, if you see anywhere, Shabnam, it's like, it's on fire.
Oh,
You see the gynecologist doing aesthetic, you see the plastic surgeon doing aesthetic, you see every field is picking up the aesthetics.
That's true.
So it's a very, very sensitive topic. The one thing that is important, the people who have the underground medical knowledge, they are the best persons to do the aesthetics. Those who have been working on the aesthetic for last many years, they are the best people to get these procedures done. Another important thing, whenever you are there for the consultation with any doctor, ask them different questions. What machines you have? You have your media, that is a Google, an easy medium for you to do the research.
Right.
So once they are pointing out that this machine we'd use, it is an American brand, it is ABCD, this brand, they are going to do the research. And yes, you can just counter check with some other. You know, Hadith says that mashawrat is always better. You can ask different people to, you know, make the final conclusion and final decision. The best is to follow the authentic doctors, whoever are doing what work on the social media. That's an easy medium to reach the different. Yes, and you can easily find the different machines, the difference between the practices and how we take care of such things, keeping one thing in mind, that we have a huge investment of these machines. There are multiple hydrofacial machines. For example, I keep on doing a lot of information type of videos on my page as well, in which I try to explain to the patients that this is authentic and this is something which is quite non-authentic and you should not go for that. So I think, yes, these little videos do help patients to...
Because now we see lots of small setups where you haven't heard about a person's qualifications.
Absolutely.
And it may be that they have acquired a laser machine and maybe the right protocols are not being used.
Absolutely,
So
that's
that can
right.
give somebody, you know, quite a bad experience. So, you know, as Dr. Shahibano said, it's very, very important to do your own research. There's Google there for us. I mean, 20 years ago, we didn't have this. So you can research and educate yourself, follow the right people in the business, the ones who are real professionals. Okay, you know, with the hundreds of things that are out there, it's so confusing. You see, you know, one day you see laser going so many places, so many different types of laser, and then you will see, okay, Botox, that's not very new. Then you have your facelifts. The ones where, you know, what, the lunchtime facelifts.
You're touching my favorite topic.
Okay, the Aptos threads. Tell us about those. I mean, you see a lot of videos. It looks really painful, is it?
Maybe I'm not the right person to ask it's painful or not. So Shabnam, anybody who's here for the consultation, I just try to explain them a little bit about anatomy. I wish I can show you one of the diagram if you can focus through your cameras.
Sure,
perfect.
Yeah.
So, okay, let's see this. So if your camera can focus on this interesting diagram. So, okay, can you guys, if you guys can focus on this picture, that will be quite helpful for all of the viewers to focus and to understand.
Okay.
Okay, so this, okay.
Right.
So one of the interesting things that I always explain to my patient is this picture. This picture is very interesting. Many patients who come to the dermatologists, they are just coming for this layer. I always tell them this is the cloth and this is the filling.
Okay.
If you do not have a proper filling, this means the cloth is not going to shine, neither lift up.
Okay.
What is happening beneath this skin layer are the extra 4 to 5 layers. What are these layers? This is the bone. That's the mass tissue which is attaching the bone and the muscle. This is the muscle. This is the fat, and in the end comes the skin. If we are not tightening these layers or not focusing on the anti-aging procedures of these layers, this means my skin will not be radiant. It won't show any effect because it doesn't have the proper filling. Now, I want to tell you something which is quite important. If the patient has hyperactivity of the muscles, frowning, nothing in the world changes except the Botox.
Okay.
If the patient has the atrophy of the fat, the flat cheeks, too much of the nasolabial grooves, this means the fat has gone. You don't have support here in the mid tissues to lift it up. Until and unless we are not replacing it with the fat graft, which plastic surgeons do, or the hyaluronic acid filler or the collagen booster fillers, you are never going to give results to the patient no matter how much work you do on the face, the skin. Many people come to us with a lot of PRPs, the microneedling treatments getting done, and they are expecting and they have been told that you're going to have the lifting effect. I will clearly say no. You are not going to have the lifting effect if you do not have the underlying fat tissue.
Right.
That is important.
Okay.
Your filling is not good, your cloth is not going to show any type of tightening. That is important. If you have dystosis, a lot of people at the age of the 30 years, they started having this type of ptosis. Aging, people think whenever we talk about the aging, they think, oh, we are just 25, we are just 30, how can we have the aging? There are two types of the agings. One is just the number, the chronological, the other is biological. So those people who are quite stressed, they face the aging very quickly.
Okay.
In a lot of people who are coming from the northern areas, you'll be surprised to see the aging at age of 20. A lot of wrinkles.
Sun exposure is that?
A lot of sun exposure, yes. So multiple factors which is attacking the skin and attacking the deep tissues leading towards the aging. Keeping in mind, whenever we have to treat this type of jowling effect in the lady who's 35, nothing is going to affect until and unless you give them the proper thread lifting.
Right.
I made a small video for my patients to explain because they have been getting a lot of fancy names, the mini threads, the mini Botox, the happy Botox, the meso Botox, or many people call it the baby Botox.
Okay.
Keeping one thing in mind, Botox is just Botox.
Right.
Thread lift is just thread lift.
Completely different things.
They are just fancy names to make you feel better.
Right.
Maybe somebody is telling you that, okay, listen, I'm not going to do too much of invasive treatment for you. I'm just doing a baby Botox for you, baby. So that baby word makes them feel good. Okay, I'm using this baby step, though it's a Botox.
Okay.
It's a Botox.
Right.
And another thing, if the patient has the drooping of this tissue, nothing will work. Only thing that will work is to bring all the vectors upward, just like the plastic surgeons. We do it with the non-surgical method, that is thread lift. And the beautiful thread is the Aptos. Why it is different from others? You just mentioned about Aptos.
Yeah.
I worked a lot on threads, Shabnam. I used to work on the PDOs before, and then I pick up the Silhouette. Silhouette is still my favorite. It's beautiful.
These are different types of
These are
threads you're
different
talking
threads.
about.
Yes.
Okay.
It might be of some interest to the people who have been doing these threads because it's very important to mention the names.
Okay.
Aptos is a beautiful thread because this is with the hyaluronic acid coating.
Okay.
This means I don't need to put the extra fillers. It is giving the work of the fillers and the lift.
So it's not only just lifting your face, it's
It
also
is
working
rejuvenating.
actively inside as well.
Absolutely, it's rejuvenating. On the 14th day when the patient is coming back to us, they see the better quality of the skin. Why? Elastin collagen formation. And that was proven through the biopsy on the different days. And it's going to last for at least 1.5 to 2 years' time.
Is there anyone who shouldn't be having this sort of treatment? Any medical concerns?
So there are two types of the groups. Like for example, if the patient has a lot of ptosis, then they are the surgical patients, not the non-surgical ones.
Okay.
That is important. For the people who have the underlying connective tissue disorders, those who have SLE, DLE, or any autoimmune disease, we have to be very, very careful.
Okay.
That is important.
Right.
Even for those patients who are little diabetic, we have to see if they have maintained their diabetes, then it's a good time to go for such procedures. Otherwise, I think it's very, very important not to do such procedures for them.
Okay. This is a lot about, procedures, a lot about many advanced technologies. What about the days when we used to say, okay, just washing your face with a good soap is
The
good
good
for you.
times.
And
I
that's
wouldn't
it.
have been sitting here then.
And then at that time, a person's beauty treatment would be round about near their wedding, where you have upturn and things like
That's
that
so
going
true.
on.
That's so true.
How would people have maintained a healthy glow? So imagine, you know, we have to go back 30 years or whatever.
Yeah.
How would a person without all this technology maintain healthy, glowing
Excellent
skin?
question. Genetics.
Oh, right.
The
okay.
genetics plays a huge role.
Mm-hmm.
Many of the people say that, look, my mother never had these procedures, but she looks so better than me. Many people come to us.
Yeah, yeah.
And I always tell them, maybe you have not inherited those genetics.
Right.
She has got the best genes,
Right.
which is actually keeping her look younger.
Uh-huh.
Secondly, do you really think the social media was that vast? It wasn't that fast, the
Yeah.
social media.
Yeah.
If you talk about the social media, the big lips and, you know, the high cheeks and etc., the social media is playing a huge role in that, giving an awareness that beside these soaps and beside these topical creams, there is something else to beautify us.
Yeah.
People used to spend a lot of money on their clothes,
Yeah.
on the jewelry. That was aesthetics in the past
Right.
days.
Right.
You know, those people who never had any procedures, or they never had any idea about such procedures that these could be done. So they used to spend money on the aesthetics, which were clothes, which were
Right.
jewelry,
Right.
the bags. Now they spend on their face, on their
Yeah.
body.
Yeah.
So the era has been changed.
Right.
I think
So genetics, but
if it
then
makes sense, I'm not sure.
it does.
Or
It
maybe
does.
you can ask the
Genetics.
lady who has been, who can answer such a question, who's been in the times where she
That's-
was living
no,
before
you're
with all
right.
the soaps and the
Genetics
creams.
play a huge role.
I can see you. I'm seeing you after 5 years and still complimenting that you look young.
Thank you so much.
Lovely.
Coming from you, that's a huge compliment, and I
Mashallah,
must
mashallah.
credit my mother for.
You
know,
should.
She has passed on amazing genes
Lovely.
in hair and skin. She really has. While we are at your clinic, we would love to see some procedures being done.
Absolutely.
So nothing too sort of, you know, scary.
I know,
you
I
know, that.
know, I know.
Something really soothing. So tell us what you have planned. What are we going to?
We have prepared two patients. One, we are doing the hydrofacial. The other, we are doing the M-Sculpt. So people know about hydrofacial. People don't know about M-Sculpt. That's a beautiful device, amazing technology, high FEM technology, which means high intensity focused muscular contractions.
Wow.
The patient is just going to lie down on the couch and they are going to give the 20,000 crunches with the abdomen.
Oh my God.
So that's crazy.
Yeah,
That's,
it is.
that's one of the world's most famous devices. That's called M-Sculpt.
Okay, let's go then into the procedure room.
Absolutely. Let's go.
So now we're moving to the procedure room and we will be able to see you at work. Okay, so right now you are going to perform a hydrofacial,
Absolutely.
and this involves a couple of steps.
Yes.
Okay.
So it's important to tell what is hydrofacial, because there are many clinics who say that they have really good hydrofacials, but one should do their research, as I was mentioning before. So in hydrofacials, we have to include different steps and different peels. One is the exfoliation, which is she is doing right now.
Okay.
The other one is the lymphatic drainage. Okay. So the lymphatic drainage is going to improve the blood supply. Shiji, can you put it back? Thank you. And you should verify that the hydrofacial should have got all these steps.
Okay.
This is the glycol prep,
Okay.
which contains the peels. That is a glycolic acid and azelaic acid peels, okay?
Right.
For exfoliation.
Right.
This is an anti-aging serum, that is a retinoid serum, which is called the Derma Builder.
Okay.
And then it has different steps. So these are the take-home treatments that we give to the patient. That is a lip revitalizing and the eye rejuvenation treatment for the dark eyes and those who have a little bit of darker lips. So these are quite authentic serums that are provided with the original hydrofacial machines.
Right.
Along with that, Shabnam, interestingly, that's the Cara V system for the hydrofacial. That is the cleaning of the scalp, not for the face.
Okay.
So that's the scalp cleaning. Many people are afraid of
This is part of the hydrofacial?
It's the part of the hydrofacial,
Okay.
yes.
Right.
So that's a cleaning of the scalp.
Okay.
Those who have the problems, those who are afraid of the needles to get the PRPs or any type of such procedures. So this is like going to infuse the serum. This is going to exfoliate and remove the dandruff or any dead skin on the scalp.
Right.
So that's quite good in recovery, and
That
the patient
is-
starts seeing the improvement in just 3 treatments.
That is something that I haven't heard of before, because
Yeah.
the PRP people have heard about for their
Yes.
hair, but that is a good
That's-
one. So
that's
that's for
interesting.
people who are sort of, you know, a bit apprehensive about needles, and they can have this, what is
you can
it
show
again?
this.
Can you tell?
So that's Cara V, okay?
Cara
So
V.
that's basically the complex kit that contains all the ingredients which helps rejuvenating the hair and the scalp. That is an anti-dandruff, those who have a little bit of psoriatic scalp, which is a very chronic problem in many of the patients, those who want the growth of the hair follicles without using too much of the needles.
Right.
And I must say that one should see all these steps while doing the hydrofacials.
Right.
So you should know what is the authentic hydrofacial equipment that is elite, okay?
So it's very important, as Dr. Shahibano is saying, to get your hydrofacial done from somebody who has the right machines, the right
Yes.
equipment. Do not be shy. Ask them what they're going to use.
And another important thing, many patients also tell us that after getting the hydrofacial from ABCD places, they are getting the acneiform eruption. Why is that so? Because they are not using the clean tips. They are using the one tip on every patient. So one should be using this tip and discard it and use the new one.
Right.
So you know, you have to see and authenticate everything while doing such procedures. Hydrofacial looks like a simple thing, but honestly it's not.
Right.
It's not. It's like a very beautiful, gentle procedure. Authentic serums do work for the flawless skin. One set, it is going to exfoliate, and on the other hand, it is going to rejuvenate the skin by infusing the serum. So that's a plus
And
point.
this is something you get done once a month? Or?
Once a month, yes.
Right.
Once a month. It's
Yeah.
quite helpful. In the active acne, we do not refer any treatments.
Okay.
So first, we have to treat the inflammation. After that, the inflammation once subsided, yes, we can go for the deep cleansing in the form of the hydrofacials and the treatment of the scars.
Right. Thank you for explaining that so well, and also thank you for our wonderful patient, for being so patient.
Thank you very much for bringing this topic in, Shabnam, and thank you, darling. Thanks. We are getting back to you. So there's another patient ready for us with the HiFi Technology. Let's see that?
Right, yes.
Okay, so let's go. That's another room. Please.
Wow, what is this? This
Wow,
looks like, again, a sci-fi movie.
Looks like again a sci-fi movie.
The advancement of the science, I must say. So this is the HiFi Technology, one of the biggest, beautiful inventions of the science. This is the HiFi Technology, the high intensity focused muscular contractions. So in West, it's quite popular because of the beach bodies. In Pakistan, still we have to give an awareness to the patients. For those people who are nicely toned, but they need a little bit of tightening and 6 abs treatment. This is interesting, and truly it gives the result for those who do not have too much of the belly fat.
Okay.
So there are many people who come to us with too much of the belly fat, so we do the little bit of liposuctions,
Right.
and then we put them under this treatment to tone up the muscles. There's another interesting device along with that. So my patient is lying down comfortably. She's going to have 20,000 crunches while just lying here. And she can
In how
do
much
it
time?
in 30 minutes.
Wow.
We can
That-
show you the before and afters. That's quite miraculous, quite important thing to show you. Another thing that is important, and we generated the awareness scheme with Leila Zuberi as well. She was very kind to be very helpful. So that's a chair. I will show you. This is covered right now. That's a
Okay.
chair that is going to improve the patients, those who have urinary incontinence. There are many ladies,
Right.
after going through the multiple labors and the childbirths, they have the weakening of the pelvic muscle floor. So in any part of the body where there is a weakening of the muscle, so this device is going to tighten up the muscles.
Okay.
So
Right.
that's without any radiations,
Yeah.
without any side effects. That's an FDA approved device, the first device that was given the FDA approval, and that's known as the M-Sculpt, and the
Right.
chair is known as the M-Sella.
Right. And is this just for the stomach, or is it, can it be
It's
used
for any
anywhere?
part of the body.
Any part of the
It's
body.
for the buttocks, it's for the glutes, for the abdominal region, for the arms, those who are getting a really hard time in reducing their arm girth. So that's quite helpful.
If we can ask our patient, is it painful? No.
I think she's quite active in work, and she's doing a lot of gym as well, so she's quite used to of these body crunches.
Okay.
For those people who are not used to of such things, they might feel a little bit of discomfort.
All right.
Yes.
Okay.
Yeah.
That's great. Well done.
Thank you very much.
Thank you.
Excellent.
Okay, welcome back. Right now we have moved to the laser lab, and that is a word you must have heard. So many people getting laser done nowadays, and Dr. Shahibano has given me these glasses to wear as well.
So safety protection.
Yeah,
first.
good,
Yeah.
well done. Tell us about laser. It's hugely popular, not just in Pakistan, all over the world.
Yes.
What are you going to show us today?
So laser. So this is, you can see this room, this is quite filled up with the lasers, the different lasers. So we have another room that has got almost 15 lasers in it. The thing is that if we just talk about the laser hair removal, so that's quite popular all around the world. There are different type of the hair removals. Why we do that? To reduce the hair growth. So the word is like a permanent hair reduction, not the permanent hair removal. We always explain to the patient, the laser machines are very important while delivering the procedures, because if the laser machine is not authentic, the result may vary, and it can give a little bit of complication to the patient if the laser machine is not good, which means they might have an extra hair on the neck that is called a pseudo-hirsutism. So that's one of the complication. Another very important thing, whenever we are doing the patient's laser hair removal, they ask us the question that why we need to trim the hair. We always do the trimming because we have to reach the deep hair follicle or the hair bulb. The extra hair on the skin may create a little bit of burn. So we try to remove it from the superficial surface and reach the deep hair follicle.
Right.
Another important question, well, this is a very, very long topic, so I might not take a lot of time because it's important to tell people that why they have extra hair on the face. There are multiple causes. So first, see the causes, whether the patient has imbalance on the hormones, whether they are applying some topical whitening creams or anything else that you have to first diagnose, and then you can start your laser hair removal.
Right, okay. And as Dr. Shahibano has said, again, it's very important to make sure that you're going to a place which has the right machines and the right people are using it professionally.
Absolutely, that's important. So we just keep it transparent. I always tell my patient that you have to trust the brand, that is an American one, which is Candela. Quite safe to use even on the Asian skins, that is a skin type 4, so that did not burn. So let's start the treatment.
And the rest is, of course, the results speak for themselves.
Absolutely, that's
Yeah?
it.
Let's go.
Yes.
Couldn't wait to put these on.
So let's prepare ourselves and let's start the laser hair removal. Okay. Okay. So we are starting the laser hair removal. We are using the chillers to make it little comfortable for our patient. Perfect. Thank you, Dr. Saiba.
Okay, that was the laser that Dr. Shahibano showed us, and something that is very, very common. People are very comfortable getting lasers.
Absolutely.
And I'm sure in expert hands like yours,
Thank you.
they would have a wonderful experience. So thanks for showing us that.
Thank you very much, and we are definitely looking forward to bring on some new laser equipments which are pain-free, hopefully, in your next program.
Pain-free.
I'll be gifting you that for sure.
How wonderful. Okay, so let's see what's happening outside.
Excellent. Let's have a look.
Okay, Dr. Shahibano, thank you so much for inviting us here into your clinic, and it has been such a wonderful experience to see close hand all the expertise that you have to offer, and I hope it was okay with all the questions that we were asking and seeing your wonderful work, and it's really been a pleasure for us.
Thank you very much, Shabnam. It's honestly my honor that you guys are here. the PTV is definitely a biggest platform for anybody to know that what aesthetic world is offering. And absolutely, we have a lot of things to discuss. And I just wish, I hope that you guys can come here again and again so we can touch every topic in detail, and that will be very, very helpful for the people who are watching the TV.
And that is so true, because there is just so much to talk about, so much available, as we were speaking about when we looked at all the different machines and the different procedures as well.
Absolutely, the indication speaks for everything, so it's very helpful for us to educate the people about the different indications and the treatments.
Absolutely. Thank you once again.
Thank you.
And that's all we have time for in today's episode. I hope you have enjoyed watching this as much as we have enjoyed filming it. Until next time, stay happy, stay healthy. Bye-bye.